How can First Breath providers help their clients maintain motivation to stay quit or stay engaged in the quit process in between visits and on a day-to-day basis?
Okay. A lot of that is probably going to depend on their circumstances. We had talked earlier about reaching out to the people in their lives and asking about, what would be rewards, what are things that they can replace cigarettes with that would be positive. So, depending on the amount of support they have, that can be part of the picture. I think, though, one thing that I hope none of the providers are overlooking is the fact that we know the support quitters get from the treatment team that they're involved in is absolutely crucial. In fact, if you look at the clinical practice guidelines, which I just happen to have, when you look at social support from treatment, that is every bit as effective and important as individual counseling is, as a lot of the medications that we use to help non-pregnant folks quit. And the fact that you are there working with them, and even though some time may pass between visits, just something as simple as wrapping up a session with a summary of the progress that they've made, maybe anticipating if they know something is coming up, but also making that real clear statement: I'm really looking forward to seeing you when you come in the next time, or I'll be calling you on whatever date it happens to be. It seems subtle, but it's a very powerful statement to that person that you care about them, not just when they're right in front of you, but all the way along. And I know from the support group that we have as part of our clinic, very often people will come in and they'll talk about a situation they were in where they were really tempted to smoke, and they'll often say, I probably would have bought a pack, or I would have asked my friend for a cigarette, but I thought about the group, and I didn't want to let you down. And that's what got them through.
It's really powerful.
Yeah, it really is. And again, it's one of those subtle things that you may not think of when you're face to face with someone, but it's not just the words you're speaking in the moment. There's a big carryover effect, and by choosing the things that you stress and a little bit of the language that they use, you can really help reinforce that for your participants.
Thank you.
Yeah.